My name is Amanda Yu. I am a pharmacist and a functional medicine practitioner. I am here locating in Pennsylvania. As a pharmacist, I've been practicing for over 28 years, but as a functional medicine practitioner, about 5 years.
What were you feeling most frustrated with before the Six-Figure Speaking Makeover mentorship for Introvert?
Before the mentorship, I know what I want to do, but I just didn't have the tools. I didn't know how to approach conventional practitioners to get referrals, or I didn't know how to deliver the message on what my practice is about. How I got into functional medicine is from my own health journey. I felt frustrated with the limited tools that I have with conventional medicines, my doctor and myself. And I've been to many specialists and we're not able to figure out what was wrong with me. I have autoimmune disease. And then being frustrated, I embarked on a journey to look for more tools to help myself. And then along the way, I studied functional medicine, I studied yoga, I studied breath work, I studied neurofascia techniques called the MELT method. So using all these different tools, I was able to support all my health challenges. And that's what inspired me to create these online coaching programs to help others to do the same. And then what your program, what your mentorship was able to help me do is how to put together a talk to present to the providers and how to bridge the communication gaps between patients and providers. And that's what I want to provide. That's what my service is.
What would you say? How were you feeling about your practice before the mentorship?
I was stuck. I didn't know what to do. I didn't know how to get clients. I didn't know how to go about getting clients. I am an introvert. I'm not a big on social medias. I don't want to go on social medias to get clients. So I just needed a way to help people to get clients, to provide my service to the people who need this service. Because as a pharmacist, I see so many people on medications and are frustrated as well, like myself. And sometimes medications don't always work, and sometimes you get a lot of side effects from medications, and some patients don't know that there are other tools, and their providers don't know that there are other tools that they can offer their patients. So that's where I come in.
What made you decide to be a part of the Six-Figure Speaking Makeover mentorship?
I saw your ad, and I am an introvert. And at the time, like I said, I didn't have a way to get clients. I didn't have a way to approach people, to how to deliver my message, how to offer my service in a way that people see that it'll be valuable, that I can help them. So I just didn't have a tool to do that. And what your program's able to do is offering us templates and guidance and a do it for you template type of tools so that we can follow, so that we can use this to deliver the message. To for me was to go to the conventional practices to offer my service to bridge the gap between the patient and the providers. So, and I was able to do that a few times now.
Oh, it's fantastic. What are you excited about that's shifted for you?
I'm excited about getting referral from the doctors and being able to offer patients guidance and help them turn around their health in a sustainable way so that they can feel better, so that they know what they can eat, what they cannot eat, so that they have more energy, so that I don't have to feel stuck and think that they have to live the rest of their life feeling sick, feeling have low energy, and not being able to eat the food that they enjoy. So I'm excited about helping people feel better.
And tell us a little bit about the opportunities you ended up getting to be in front of the providers, and tell us a little bit about the different ones.
Yeah, so just yesterday I went to a provider's office and deliver my talk and provide my service or offer them, telling them about my service. And they were pretty receptive to what I had to say. So they said that they will refer. They often refer their patient to nutritionists, to dietitians, to other specialists. But there are some patients who are not getting better. And what my service can offer is a whole comprehensive personalized treatment plans where we look at everything, not just food, but mindset, movement, food sensitivity, hydrations, stomach acid. So just supporting the whole system, the whole body systems, looking at everything, looking at
Yeah, it's
the root
exciting.
causes.
And
Yeah.
so, tell us a little bit about like before the mentorship, what made you decide you had an interest in developing relationships with providers for referrals?
I I hadn't thought about it. I did want to get doctor referral, but I didn't have a way of doing that. I didn't know how to do that. I didn't know how to approach them. I did made phone calls prior to working with you, but I didn't get anywhere. You know, I didn't know what to say. So pretty much, I called them and asked them if they provide functional medicine. They would say no. If I asked them if they would like to learn more about it, they say no. So now that I have tools, I'm able to get into their offices fairly easily. So, and
Yeah, it's exciting.
yes,
And
yes.
what are some of the different kinds of providers you have connected with and or have gotten opportunities in front of?
So far, I've gone to a couple of primary care providers, and they were very receptive to what I had to say. And I reach out to a dermatologist as well. And I do have another one coming up next week with another primary care provider. So, and they seem pretty excited about functional medicine and to learn more about functional medicine. And I really do believe that functional medicine is the future of our healthcare. I mean, comprehensive, personalized medicine.
It's awesome that you have this vision to help people in that way. And you also have a pharmacist background too. So understanding the Western medical side of things as well. How do you feel like the Six Figure Speaking Makeover mentorship has helped you?
The coaching, the group coaching calls, and also having the templates, having the guidance and the framework on what to say, how to say, and how to present. I think that's a big part for me because you probably can tell I'm not a natural public speaker. I fear public speaking. I don't enjoy speaking in front of groups, but because of my passion to help and to help people and to want to deliver this message, want to raise awareness on the root cause approach, it's forces me to do this, to go out and speak in front of people, in front of providers. And I think your program has offered me provide me the tools to do that.
And what was this experience like for you? Like, what was your favorite part of the experience?
The coaching. I enjoy coming on to the coaching call and being able to ask questions and to work through and what we have and how we plan to present our program.
What did you think about the done for you templates and scripts?
Yes, I love the templates and scripts, and that I think that's a major piece for me because knowing what to say and how to say and when to say certain provide certain pieces of information. So just having the framework, just having the guideline, that's a huge benefit. That's a big help for me.
Tell everybody about your services in a nutshell and what you charge.
My service is an online coaching program. We provide comprehensive personalized treatment plans. We hold our clients accountable. We meet every week. We provide the roadmap. It's a 6-week program to take somebody through step-by-step program to figure out what the root cause is. We do food sensitivity testing. We do hormone testing. We look at nutrients and we help them with mindset work and we help them with movement. So just pretty much address all aspects of the bodies, all the functions. And what we charge is this for a 6-week program, we charge $2,300. And so it's very exciting. And I look forward to helping more. Yes, very comprehensive, but personalized. So we provide the frameworks, but our clients have to do the work. So it's a partnership. So we provide you the tools, education, and you learn and you implement and see what listen to your body, and we pivot and then we troubleshoot. And by the end of 6 weeks, we will figure out what else we need to do. But usually they'll have the tools and they'll have the education on going forward, how to take care of themselves, how to take care of their health.
What's your vision for your practice that you're excited about?
My vision is hopefully to get more referral from the doctors and being able to partner with some of the providers to collaborate and provide this missing piece of service to bridge the gap between the patients and the providers and offer patients guidance, accountability to hold them and guide them so that they are an active participant in their health and not just the passive passenger. They are becoming the driver of their own health. So I think that's exciting. And
what was this mentorship experience like for you, by the way? What was this mentorship experience for you as an introvert?
I enjoyed it. Again, as an introvert, I don't like to be out there. I don't like to talk in front of people. But it's a small group. It's quiet, and there's structure, there's guidance. So I enjoyed the program.
If you knew then what you know now, what advice would you give?
I would say just go out there and just, if you want to do something, just go out there and just do it. If it doesn't matter if you're scared, just do it. And there's no failing, there's just growth. And I think with your program, you have, provide us the framework. So give us the confidence to do that. So I do feel more confidence after gone through the program to be able to deliver my speech, my talk, more confident than before. So courage, just do it. Even if you're scared, just do it anyway, right?
What would you say to someone who might be on the fence?
I say just listen to your intuition. For me, I didn't know if this is going to do anything or not before I sign on the program, but I just knew that I had to do something. If you didn't do anything, nothing is going to change, right? So if you take a chance to do something, there'll be a change. There'll be some type of a change. So I can say with this program, it has helped me. So I'm glad I took that chance. So I did learn something and it has benefited me going forward. So I have tools and I feel more confident.
Yeah, it's wonderful that you're having opportunities to connect with providers and about collaborating, and exciting that you have clients you're working with and doing things in such a comprehensive way to help them through functional medicine, and just Yeah, I mean, from what you've shared with me, it's like it just feels so much more rewarding, right, than
Hmm.
practicing as a pharmacist in a
Oh,
pharmacy.
absolutely. Yes, absolutely. Yes. And, I thought I was going to be nervous giving my talks to the providers, but I wasn't. So I was surprised that I just went in and just pretty much share what I have to share and just went in there. Hey, look, listen, this is what I have. I think it's pretty amazing and can help your patient get better. So, take it or leave it. So, I mean, I didn't say that, but I didn't feel nervous. So that was surprising. That was surprising to me. A good
That's good.
surprise. Yeah.
Yay. Well, thank you so
Yeah.
much for taking the time to share and be here with us today, and to you continuing to help more people through functional medicine. And for those of you who are at a place in your practice where you're at a plateau, or you would love to have it grow faster, and some of you may actually want to be able to have it run more without you, or even add another stream of income, then feel free to go to introvertedvisionary.com and book a free chat to see how we can help you with growing faster and with less stress. So till next time.